These recommendations are examples of how nurses and healthcare professionals can put the implications listed on the previous slide into practice. The first recommendation is that within nursing practice, nurses must use information technology that is electronically linked in the effort to eliminate overlap and confusion between healthcare providers. I talked about this on the previous slide and just highlighted the fact that it's very important for all the healthcare providers to be on the same page, and that can only be done if the informatics technology is linked. If one healthcare provider is using one type of technology and that information isn't transferred over to the other type of technology, there is an incongruency there and there will be a miscommunication that could harm the patient. The second recommendation is that nurses must be adequately trained prior to the use of informatics technologies that their workplace utilizes, and nurses must partake in additional periodic training sessions as technology evolves and is updated in order to maintain their competency. One example of this could be continuing education requirements and how some nurses who haven't practiced in a while or an older generation of nurses might not know how to use some of the technology that has just recently been developed. And so it's important to do continuing education credits that are about nursing informatics, or even on the job if there's an update to the technology. It would be really important for people in charge to coordinate some type of class or training session for the nurses to teach them how to use the new technology. The third recommendation is that nurses must not fully rely on technology to do their job for them. They must still possess the ability to complete their tasks manually. However, they must take advantage of the time that is freed up by the automation of certain menial tasks by spending that time with patients and enhancing the personal aspect of patient care. That pretty much explains the whole last recommendation. It's just really important for nurses to take advantage of the time that the informatics technology frees up and utilize that to do their job better instead of make their job easier.